Hey, what's up everyone? Dr. Lee Thomas here. Our team and I have put together another great episode for you to help continue to give you the tools you need to work on optimizing your health. If you're not already, you can access all this information on our social media channels. So on Spotify, on YouTube, all at our channel name at Be Aligned Health. We're also on all the other social media networks like Facebook and Instagram. Today we're talking about a really important topic, which is how to improve and how to optimize your sleep. I think a lot of us know that sleep is important, something that's really vital for us to have ideal and optimal health, but so many of us are not getting the sleep that we rightfully need and that we rightfully deserve, and that helps get our body back to a good and great functional level. Sleep is really the foundation of your overall mental and overall health. This is the thing that tells you if you're going to live longer or shorter. These aren't just thoughts in my head. These are real research studies that have all come out within the last few years. There's an important study that came out of the American Journal of Cardiology among men and women who report better sleep overall. So people who self-report that they have great sleep versus moderate or poor sleep. Men on average live 4.7 years longer, and women on average live 2.4 years longer. So again, great sleep can help you live longer. It also impacts greatly your memory. Our memories seem to become more stable in the brain during the deep stages of sleep. So according to Matthew Walker, who's a professor of neuroscience and psychology at UC Berkeley, he showed that from MRI scans, the slow brain waves of stage 3 sleep are what act as a courier service. That's what helps transport memories into our hippocampus to a more permanent storage site. So if we're not getting into deep sleep, it affects our body's ability to store and save memories. Strength is also another massive factor when it comes to sleep. Here's a study out of Biomed Central that showed that changes in sleep duration and changes in sleep quality affect not only muscle mass in our body, but also fat deposition in all the ways that you don't want, meaning non-healthy sleep. If you don't get enough sleep or good quality sleep, you end up burning less fat and you end up holding on to less muscle. So muscles get smaller, bellies get bigger. Definitely not what I have as a goal in my life at all. And so what I want to go through on the show today is just the research benefits of sleep and really the tools to work on equipping yourself with to start getting amazing sleep. We're going to run down through the optimal tools at first, and then at the end of this episode, I'm going to try to walk you through a perfect wake sleep cycle, going through as many parameters as possible to help, again, you optimize your sleep. Let's talk first about the important steps to making sure that you get healthy sleep, what those criteria are. The first thing that we'll talk about is having the right body temperature. Body temperature is vital for sleep. There's a 1 to 3 degree temperature drop in your body that helps you to fall asleep. Honestly, without that, your body is not going to enter a deep sleep. So we talk about temperatures being a really important thing, especially in my house. We know the temperature drop is vital. So my whole family and I are on board with, at night, the heat going off or going way down. We want it to be cool inside of our home to allow for that temperature drop to occur. Maybe some of you guys have gone to some people's houses before. I know I've done this before, where they have the thermostat set to 72 or 73 degrees. And I find myself not only warm in bed at night, throwing the covers off of me, shifting, twisting, turning a lot. Those are the things that are going to surmount to a terrible night's sleep if you just look at temperature as being the only factor. There are a lot of new technologies out now that can actually help to cool your mattress down, so you may not have to, in the heat of summer, cool your entire home in order to get to fall asleep. They make now cooling mattress covers that can help you keep that low body temperature so that you can enter deep sleep. Make sure that you're honoring your body and doing that the right things to help your temperature drop before bed, like a cooler environment. It's going to really help with great sleep. The second thing that we'll talk about is the brain and body cues that your body needs to wake and to sleep. We're talking specifically light and dark. Light and photons help you wake up, and we know that darkness helps your nervous system calm down. So we'll spend some time on the show talking through specifically when to utilize the right type of light, whether it's outdoor light or inside light, and also how to use darkness to help trigger your body to start sleeping effectively. food is a huge source and a lever you can pull on how to help regulate sleep, not only when you eat, but how much you eat. So we'll talk about that on the show today. The number 4 is exercise. Exercise plays a big role in our body temperature. It also plays a massive role in our serotonin, dopamine pathways. So exercise is a great tool that we can use to help induce sleep and help regulate our sleep and wake rhythms. Another lever that we can pull is caffeine and other stimulants. I get asked by a lot of patients, what's a normal amount of caffeine to have? Should I do stimulants? If I should, are they addictive? What should I look at for that? We have a molecule inside of our body called adenosine, and the longer that adenosine is high, the more we get tired, so it starts raising throughout the day. The reason that caffeine works is it blocks the absorption of adenosine. So it's not that caffeine gives us energy, it's that it shuts down the molecule that tells us that we're tired. I think that you can still use caffeine in moderation. You can use it as a tool. If I said you can never have caffeine, everyone would hate me because there's a Starbucks in every corner. So you can use caffeine, but I think it needs to be done in an intelligent manner. And I think a lot of us can tend to abuse it. So we'll talk about that on the show today. We're also going to talk about the right supplements. So what are the good and the bad that can really help you get a good night's sleep? There's a lot of supplements that are out there in the market. A lot of things are purported to help with sleep. And being someone who's been in the health and fitness field and wellness field for a long time, I would say that you wouldn't just want to look at these specific supplements, but work on overworking your entire diet. If you're interested in that, you can listen to our other shows on nutrition, because if your nutrition is off, I don't just say take these supplements to help sleep, but these are some of the really important, most researched ones that can help benefit sleep. The next and the last things that we'll talk about is managing your stress levels and understanding how pain plays a factor in sleep and wake. We're going to spend some time going through all of those things and more on the show today. So let's start with going through what a normal sleep wake cycle looks like. How do you schedule out your day so that you activate the right hormones in your body, so that you wake up when you're supposed to, you get your peaks in energy when you're supposed to, and then you end up feeling tired and falling asleep when you're supposed to. So in walking through it, what happens? So the first thing that happens whenever you wake from rest is that your body temperature starts to increase. That's actually why you wake up. So this increase in cortisol is what begins to wake our body up. Now, a lot of times you'll think about cortisol as being the stress hormone. Cortisol is not just bad. It helps enhance our body's immune system function. So cortisol in the short term and when it's produced by our body in normal amounts can be very, very beneficial for our overall health. Obviously, you don't want high cortisol for a long period of time. That can lead to fat deposition and a lowered immune system. But this increase in cortisol in the beginning part of the day is what really helps to start waking us up. That's what increases our metabolism, and cortisol is what increases our body's desire to start moving. The first thing is you've got to recognize that your body needs to start warming when you wake up. That's why getting out and getting some sunlight in the morning is really important. That's why when you wake up and you're cold, you don't want to do anything. So you can use a lot of tools that help you wake up in the morning and help naturally build your energy. One of the things I'm always talking to my patients about is not jumping for caffeine first thing in the morning. So what do you want to do to help your body wake up naturally? You want to, ideally speaking, view bright light. This is within 30 to 60 minutes of waking. It seems like a totally natural phenomenon to expose your body to light first thing in the morning. It is what helps our body wake up. We have specific nerve cells inside of our eyes that respond to bright light, and they signal to neurons in the roof of your mouth that help basically start the entire sleep-wake cycle. So they start a 16-hour cycle inside of your body that says, hey, now is time to wake up. And roughly 16 hours from now it's time to go to bed. When you wake up, go outside, get exposure to that bright light. You don't have to stare directly at it, but getting the exposure to it on your skin and in your eyes is really helpful. If there's cloud cover, you still want to go outside. You may need more than 5 minutes if it's really cloudy outside. You may need more like 10, 15, 20, maybe even 30 minutes if it's in the winter and the sun sits really low in the sky and doesn't get that high. And it can be oftentimes really dark as well. So if you can't get real light exposure in the morning, what should you do? Well, if you absolutely can't get exposure to outside light in the morning, let's say maybe you wake up too early and the sun's not out yet, you want to expose yourself to artificial light. And what I would tell you to do is you can use a really, really bright light, something like a ring light, one of those lights that lights up your entire face. I use a red light in the morning if I'm getting up early in mornings. The exposure to the red light is going to help to wake your body up. You have to think about this is that outside, they measure light in terms of luxes, of lux. And so outside, it can be anywhere from 5 to 10,000, even 100,000 lux. You know, inside, your light bulb may only be 40 or 50 lux, or at most with a ring light, like 1,000 lux. So it's still a lot less if you're getting exposure to internal light versus outside light. But that's a really, really vital component of waking up. And unfortunately, I think a lot of us miss that in the morning. That exposure to bright light as well helps downregulate melatonin, which is your sleep hormone. So again, you're gonna be able to wake up and feel energized, honestly, before you even get your morning coffee. So the next thing is you wanna work on leveraging temperature as a tool. Again, waking up in the morning, you wanna work on increasing your body's internal temperature. So there are ways that you can increase your body's internal temperature faster than normal. And it's kind of the opposite of what you would think. So for example, doing a cold shower in the morning is going to actually force your body to start to warm up more. So people who like to do cold plunges or cold showers, you rarely hear about them doing it at night before bed, because if they did that, it would increase their body temperature and they wouldn't be able to fall asleep. Conversely, cold exposure in the morning is one of the best ways to work on waking up. You can also exercise. Exercise is a great way to increase your body's internal temperature. Some of the best time that you can exercise are just after waking within that first hour. Another great time to exercise is early to mid-afternoon or very early evening. You want to really work on avoiding exercise late into the night. It's going to push back your circadian rhythm cycle. You're going to feel like you're awake for longer, like you've got great energy. But really what's happening there is you're pushing your circadian rhythm cycle, and then you're going to end up being groggy the next day, unfortunately. So next it would be caffeine use, using it early in the morning. I personally don't do a lot of caffeine. I'm a naturally pretty wired person. People ask me what I'm on sometimes. I tell them I'm high on life. I'm not a huge fan of caffeine first thing in the morning. And what you have to realize with caffeine, like I said before, is caffeine is an adenosine antagonist. So again, it's shutting off a chemical pathway inside of your body versus actually giving you energy. So again, what research shows is the best is that you want to wait to do your caffeine for the first 60 to 90 minutes of waking. So you wouldn't do it right at 6 a.m., for example, when you wake. You'd want to wait past that point, an hour to an hour and a half, and then start doing it there. If you wait and do it later on in the morning, you're going to avoid that afternoon crash. If you start also doing caffeine in the afternoon or in the evening, caffeine has a half-life of about 6 hours. So if you do caffeine after 4 p.m., you're still going to have parts of that caffeine inside of your body when you're trying to wind down for sleep. And again, it's going to affect your circadian rhythm cycles. So later in the morning, not too late in the afternoon or in the evening. So the next lever that we talked about is food. You want to support your body's energy production early in the day. Some people love to intermittently fast. Some people naturally are pretty hungry in the morning. I've done both ways in it, and I think this is a really individual choice that you can make here. But what we'll talk about is this. If you are hungry in the morning and you're someone who's constantly hungry, don't think that just because you're not intermittently fasting doesn't mean that you're not healthy. A lot of people eat breakfast and eat early in the morning, and they've got great healthy bodies and great immune systems, and their bodies work really well. So again, don't feel like you have to intermittently fast every single day. Me personally, sometimes I wake up in the morning and I am absolutely starving, and I'm taking care of people, in our clinic early in the morning. So I'm going to eat something, because without that, I don't have the energy to even get through the morning. So again, you got to play it by ear with this, but eating is a way to increase your body's energy and sort of wake your body up. Now, the volume and what you eat really matters, especially with your first meal of the day. I don't want to spend this entire talk going through a nutrition seminar. We've got a lot of videos on that, but let's just kind of briefly cover the things you want to hit with your first meal of the day. The first thing is you want to get enough protein in your body that you shut off your body's catabolic cycles. So roughly that'd be around 35 grams of protein. There's something called a leucine score, which is the grams of leucine inside of your protein. Leucine is just an amino acid. And when you get a leucine score of above 3 in your body, above 3 grams, that's when your body starts shutting off the catabolic pathways or the muscle breakdown pathways. and starts the anabolic pathways or the muscle building pathways. So again, protein first thing in the morning, really important to get your body to go back into a muscle building state, and it really helps with energy production throughout the day. I always emphasize good, clean, healthy fats in the morning, lots of omega-3 fatty acids to give your brain the fuel it needs. If you're going to use carbohydrates as well, keep them to clean sources that are complex, that don't give you the massive surge in energy followed by the crash. You want slow carbohydrates, 100% grains, ideally speaking stone ground, not the white bread, the super high glycemic index carbohydrates that spike you and crash you. You want to avoid those as much as you can. You also want to avoid having too massive of a breakfast. We've always made this mistake on Saturday mornings or Sunday mornings. You wake up with lots of energy and you drop 1,000 calories for your first meal, and not the healthiest way. And by 11 o'clock, you're passed out on the couch, and then all of a sudden your sleep-wake cycle is off. Again, having a good sleep regulation is about consistency with this. Don't go too crazy on the weekends. Keep it great during the week. A lot of times we might do things really well Monday through Friday, and then Saturday, Sunday, the wheels go off. We try to sleep in late. We sleep an extra 3-4 hours, which we don't want to do. You don't want to sleep more than an hour late on the weekends. You want to, again, keep to a pretty consistent rhythm of circadian rhythm regulation. That's what's really going to help you long-term continue on this process of improving sleep time after time after time. That's what you want. So midday. Midday, not a lot to say about midday. You can't win the race with things you do during the middle of the day, but you can also do some things that lose the race. Some of the big things would be napping too long. You can nap. There's nothing wrong with napping, but if you nap, it should be more of a short nap, something just to energize your body, 15, 20 minutes, a time to reset your mind, versus taking an hour or two long nap that again is going to mess up your circadian rhythm cycle and push your nighttime sleep hour back more. Caffeine is another thing that you can do midday that's going to hurt you in the long run. Generally speaking, midday's easy. Take a light nap. Don't do caffeine after 3 or 4 p.m. You want your last caffeine hit to be more than 6 hours before bedtime. Okay. The most critical period that we'll talk about when it comes to sleep is critical period number 3, which is really, evening, 6, 7 p.m. until we go to bed at night. This is where a lot of people mess up their sleep habits. Phone addictions, technology addictions, binge watching shows, too many lights at night. Let's go through all this stuff together. So in the evening, you really want to avoid bright artificial lights of really any color. I know there's a lot of talk about blue light out there, and yes, blue light's not great for you. Think the bright lights of Vegas. There's a reason those lights are so bright. They don't want you doing what there? They don't want you sleeping. They downregulate your body's melatonin production. Melatonin is the hormone that helps your body fall asleep. So you really need to think about how you lay your house out and limiting those exposures. So in the evening time, you want to have your lights, ideally speaking, on dimmers, or you want to have them darn near off, especially in the last 2 hours before you go to bed. The exposure to the bright lights is what's going to push your bedtime back hours on end and keep you awake. The other source of light exposure that a lot of us deal with is cell phone exposure. Cell phone activity, especially before bed, is something that's going to keep you awake. So if you have to be on your phone or you're going to watch TV, there are light settings on all of those, and you want to turn them all the way down. Like the TV that we have in our room, sometimes we will watch some things, a little bit later in the evening. We turn the light setting, it's like nearly off, and it has very little brightness to it. But what you'll notice is if you're watching something with the light turned down that much, your body will start to just feel tired and you'll naturally start to fall asleep. When you have the lights dim in your house, you'll realize that circadian rhythm cycle will start to kick in normally, and you will get tired and you will fall asleep, and you'll have much better sleep. When you go to sleep in your room as well, you want a dark room. Ideally speaking, you don't want to sleep with any type of screen or light on. The darker your home, the better. Moonlight is something that drives me crazy sometimes. We sleep with our house directly facing the moon most times, and even that light can bother me, so we use blackout shades in our room. We use a fan to circulate the air so it stays cool, and I'll even use a sleep mask sometimes to make sure that I shut out all the light possible. Again, you get exposure to lights at night, and it's really going to keep pushing you more and more awake. Last thing we'll talk about with just end of the night, nightcaps are very common. Alcohol and sleep. We know that alcohol disrupts sleep. You may think it helps you fall asleep, and it does. It can help make you pass out, But what you have to understand is the science shows is that our sleep patterns become interrupted if we're drinking too much, especially before bed. Our liver's processing alcohol and detoxifying from that, so it makes it really hard to get a great night's sleep. So that's an ideal perfect day. Good sleep starts by what you do first thing in the morning, and the better you set up your morning into your midday, the better you're gonna have rest at night. This is not an exact science, and we're still learning more when it comes to sleep, but the more you work on this, the better you're gonna see your quality of life become. The last things we're going to talk about are avoiding stress and working on reducing your pain levels and your overall neurological function levels. And then we'll talk about supplements at the very end, and we'll break for this session. If we're carrying around a lot of mental, emotional stress, that directly affects our body's ability to sleep at night. Stress is something that raises cortisol. And when we have raised cortisol inside of our body, it pushes our body into a fight or flight or a sympathetic nervous system state. When our body goes into a sympathetic state, that's kind of an active and awake state. The opposite of that being a parasympathetic or a resting, digesting state. Mental stress can really affect us at night. That's why it's important to not do really stressful tasks in the last couple hours before bed. Try to get all your work done, before you start winding down for sleep. Journaling can be a really effective thing. Ideally speaking, you want to take all of the stuff that's in your head and put it out on paper before you fall asleep. If you're holding and harboring all those stressful emotions and things in your body and your head, it's gonna make it really hard to get restful sleep at the end of the night. And that's why I think it's so important to make sure that your body is well aligned and well adjusted. There's so many people now who come into my office who openly struggle with sleep because of their spine being in a bad alignment, or they're having neck issues or back issues or shoulder issues. Being able to lie in your bed and rest well is an extremely important component of obviously a good night's sleep. We know that some of the best sleeping positions are either on your back or on your side, and we should really be tossing and turning less rather than more. And so if our spine's in a bad alignment, if we are not getting adjusted regularly, or working on making sure that we are staying in a good alignment with doing home rehabilitation exercises, simply put, that pain, that discomfort, that misalignment, that shift is gonna impair our body's ability to sleep. And I talk to people who don't understand this concept, who come into my office, who are on their 4th or 5th mattress because they tend to think that it's their mattress that's causing the problem and not their spine. And I'll tell you, if you're having trouble sleeping because you have neck pain at night, because you have back pain at night, there's a good chance it's not your pillow or your mattress, that there's something shifted or going on with your spine. If you're listening to this online and you have more questions on how to gain good spinal health and great nervous system function through corrective chiropractic care or wellness chiropractic care, I encourage you to drop a comment below, send us an email, or you can check us out on our website at bealignedhealth.com. We have corrective and wellness programs for all ages, starting from birth, and our oldest patient is 90 years old. So no matter where you are with your spinal health, we'd love to be able to work with you and help you achieve your best level of health. All right, so the last thing that we're gonna talk about is the right supplements to help with sleep. There are 4 really important research supplements that can help you get to and stay asleep. The first one is magnesium. Magnesium helps with muscle repair, and it helps to calm the body down. What researchers understand is that magnesium helps to relax the central nervous system. So this causes chemical reactions in your body that actually increase sleepiness. And there's new studies out showing that magnesium may actually help to reverse the age-related changes in sleep that are often seen in older adults. The next supplement is theanine, or L-theanine. It's an amino acid that naturally is found in tea leaves, and it has an anxiolytic effect, so like an anti-anxiety effect, very similar to what you'd see in like a prescription medication. Our body needs anxiolysis, or an upregulation in things that help control anxiety, to help us initiate high quality sleep. So theanine is a great way to calm your body down without using pharmaceuticals. Inositol is another great supplement to use if you have a tough time falling back asleep when waking up. We know that inositol supplementation can help to calm anxiety and sort of quiet the mental chatter that keeps a lot of us up at night. This activates, inositol does, the serotonin pathways in our body and the orexin pathways. And that's what really helped to stop our mind from racing. thinking about it as like sweeping up the floor of all the different crumbs and things that are in your mind that are just constantly pressing you for your attention and stopping you from getting to sleep. The last one would be a supplement that I love that's called 5-HTP or 5-hydroxytryptophan. This is a precursor to your serotonin and dopamine pathways. We know that taking 5-HTP can help to increase serotonin levels in the brain. Serotonin is the neurotransmitter that helps regulate your mood, your appetite, and your circadian rhythm cycles. This has a positive effect on sleep overall, and it can help a lot of other things inside of your body. We commonly use 5-hydroxytryptophan to help our patients who have sleep problems. With having helped patients with sleep issues and people with pain and problems, we have a couple supplements in our office that are very helpful. One is our sleep and mood supplement. Our sleep and mood supplement contains L-theanine and inositol and 5-HTP all combined together. This is something that you would take before you go to bed, and it helps you sleep well, both getting to sleep and staying asleep. So it helps to really reduce those midnight wake-ups, and it's a great way to work on getting your body regulated if you're having a tough time with it. I also recommend people who have really stressful lives, who are very active, who are working out a lot, to use magnesium at night before bed. It helps to calm your body, it helps to regenerate your muscles at night, helps to kind of relax your body so you just kind of sink into your bed and fall asleep well. The magnesium that I recommend for a lot of my patients is magnesium glycinate. It's a highly absorbable form of magnesium that also doesn't carry the unwanted GI effects like IBS. Anywhere from 200 to 400 milligrams of magnesium at night before bed is a great dose of supplement to start with to help your body get to and fall asleep. With how much stress a lot of us have, lots of us are magnesium deficient, and this is a great way to work on combating that. Hope this was a helpful show for you guys. By no means is this a comprehensive list of everything you can do to work on benefiting your sleep, but hopefully this gives you a great place to start when it comes to optimizing your sleep and getting yourself healthier. Again, we'd love your comments below, or if you have suggestions for more shows that we can do, we'd love to hear your thoughts on them. As always, I hope you guys enjoyed this show, and we look forward to seeing you all in the next episode. If you haven't already, make sure you subscribe and like us online. Please share this with your friends. Our whole goal for doing this is to make sure we get this out to as many people as possible. This is Dr. Lee Thomas from Be Aligned Health in Columbus, Ohio. We'll see you guys soon.